name is Maria Boca. I'm a nursing student, and I want to assess your head to toe to make sure your health is normal and in good situation. Is that fine for you?
Yeah.
Can I ask your name and date of birth?
K1, 26th of March 1979.
Okay. Can I have your consent to continue?
Sure.
Whenever you feel pain or discomfort, please let me know. I close the curtain for privacy. Patient is at the stated age, and the appearance seems there is no discoloration and no odor. About body posture, it's upright, symmetrical, and seems well nourished. And facial expression is appropriate according to the situation. Well dressed and well hygiene is, and there is eye contact. Can I ask you to walk, please? Thank you, and go back. Gait is steady and balanced and about breath. There is no sign of distress and use of accessory muscles or shortness of breath. For neurological test, do you know where we are?
Yep, you're at home.
And which day is it?
Monday.
And could you repeat your name, please, and date of birth?
K1, 26th of March 1979.
Patient is oriented to person, place, and day and time, and speech is clear, and behavior and mood is calm. At first, I check cranial nerve 7, that is facial. Could you show me your teeth and smile, and puff out your cheeks, frown, and raise your eyebrow, and close your eyes tightly and try to open it against the resistance. Okay. Facial movement is appropriate, and there is no drooping or weakness. Cranial nerve 7 is intact. To check cranial nerve 3, that is oculomotor, I check pupils shape. It's round and it's equal, and I check it for both pupils. It's symmetrical and it's 3 millimeters. I check reflection to the light. Both pupils constrict, and pupil constrict directly in the same eye and concentrally in the opposite eye. Could you please look at the wall behind me, and now my finger? Okay, accommodation is appropriate. Pupils are equal and round and reactive to the light and accommodation. That's parallel. Cranial nerve 3 is intact. I go for cranial nerve 8, that is acoustic. I repeat 3 words and whisper it, and I ask you to cover opposite ear, and after that repeat my words. Okay. Cover back. Table, window, floor.
Table, window, floor.
Sunrise, sunshine.
Sunrise, sunshine.
Patient repeat my words correctly and clearly, So cranial nerve 8 is intact. Nose is midline and there is no discharge. Cranial nerve 9 is glossopharyngeal and 10 is vagus. Please open your mouth and say ah. Okay. When a patient says said ah, uvula and soft palate raise symmetrically. It shows that cranial nerve 9 and 10 are intact. Can I see your hands? Okay. Hair distribution is appropriate and even regarding age, and color is even and there is no discoloration. Arms are symmetrical, no lesion and no scar. Now I palpate. Skin is dry, warm, and no tenderness, no moisture, and no mass or deformity. Do you feel any pain?
No.
Okay. Thank you. Now I check radial pulse simultaneously, bilaterally, for rate and equality for 15 seconds. It's 20 times 4, it's 80. That's normal and appropriate. I check brachial simultaneously, bilaterally, for rate and equality, same for 15 seconds. It's 20 times 4, it's 80. That's appropriate, and pulse is equal and regular and 2+. And for radial, that pulse 2+ and equal as well. For capillary refill, I press bed of nail and let it go. Color goes back less than 2 seconds. Capillary refill is intact. To check range of motion, please bend your arms. It's flexion and straighten. It's dorsiflexion and it's extension. And squeeze my hands. Grief and straight is strength is strong bilaterally. And could you palms up? It's supination, and palms down, pronation. Thank you. Did you feel any pain, creptation?
No.
And there was no altered range of motion. And now I go for legs. Could you take it a bit up? I inspect for color, and that's even and it's symmetrical. There is no sign of deformity, no scar, no lesion. Hair distribution is even and normal according to the age. Now I palpate. Skin is warm, dry, and warm, dry, and there is no smooth, and there is no moisture and tenderness or mass. Okay. Now I want to check pulse at first for dorsal. At first for dorsalis for dorsalis pedis. That is on top of the foot, along nose, along toes. I do it simultaneously, bilaterally, for rate and equality. It's equal bilaterally, and it's strong 2 plus and 20 for 15 seconds, and that's 80 for 1 minute. To check posterior tibialis, it's behind inner ankle here. I do it simultaneously, bilaterally, for rate and equality. For I check for 15 seconds, it's 20. For 1 minute, it's 80. That's appropriate, and it's 2 plus and equal. And for capillary fill, I press bed of nail and let it go. The color goes back less than 2 seconds. That's appropriate. To check range of motion, please stretch your legs, and that's extension, and bend it. It's flexion. And please put your toes down. It's dorsiflexion, and opposite of that, that was plantiflexion, and it's dorsiflexion. That's symmetrical and normal. Could you press my arms, my hands? Okay. It's strong bilaterally for both legs. Did you feel any pain or cractation?
No.
And there was no altered range of motion. To check thorax, first I inspect. Color is even and normal compared to the rest of the body, and is symmetrical, and there is no skeletal deformity. And now I palpate. Do you feel any pain?
No.
And skin is dry, and no masses, no texture, and please take a deep breath. When patient take a deep breath, my fingers, my toes moves apart, so chest expansion is symmetrical. I check posterior and anterior compare with transverse diameter. That's 1 to 2 ratio, and it's appropriate, and there is no chest barrel. And I check lungs for rate and rhythm. It's appropriate, and there is no shallow or shortness breath, and it's regular and symmetrical. Now I want to auscultate chest for brachial, that is around tracheal, and for broncho, it was for bronchial, beside tracheal, and the sound is high pitch. And for bronchovesicular, that's between first and second intercostal space, and vesicular, that is peripheral lungs, that's low pitch. And for bronchovesicular, that was medium pitch. For each point, please take a deep breath. Sound was clear and I didn't hear any adventitious sound. For example, crackle or whistle sound. Okay. To check heart, I auscultate valves. At first, for aortic, it's on at second intercostal space, right side of the body and right of the sternal border. Pulmonic is left of the body at second intercostal space. Herbs at third intercostal space, left of the body, left side of sternal border. Tricuspid at fourth intercostal space, left side of the body. Mitral at fifth intercostal space, left side of the body. I check apical pulse for 1 minute for rate and quality. Rate are regular and normal, and it's 80. That is appropriate. I heard S2 sound better at aortic and pulmonic valves, and S1 at mitral valves. I did it with diaphragm side. To check extra hard sound, please lay down here, lateral. And left of your body, please. I do it with bedside. At the same valve, point of valves: aortic, pulmonic, herbs, tricuspid, mitral. Okay. And there is no extra hard sound heard like S3, S4, and murmurs. Okay, could you please lay down on your back and to check abdominal, I put pillow behind patient's knee. Please bend your knees. Okay. And I drape body just for chest and for legs, just show abdominal space. At first, I inspect for color that's even and hair distribution. It's appropriate according to the gender and other parts of the body. And umbilicus is in midline. It's symmetrical and it's flat. Contour is flat. Okay. Now I auscultate for vowel sound. I check it in 4 quadrants. At first for right lower quadrant, upper right quadrant, I go clockwise. For upper left quadrant and lower left quadrant. Vowel sounds are active and present for every 5 to 15 seconds, and the sound was active. Now I palpate for quadrants. Do you feel any pain?
No.
Do you feel any pain?
No.
I do it very gentle. Okay, there is no mass and rigidity. And I check bladder, and it's upper symphysis pubis. Do you feel any pain?
No.
Okay, thank you. Thank you.